All right, and we should be live. Hi, everyone, and welcome back to another session with DentalShadowers. Today, we're joined by Dr. Joyce, who will be talking about general dentistry. Doctor, thanks so much for taking the time to join us today and to connect. Please feel free to take it away whenever you're ready.
Awesome. Well, thank you for having me. I really appreciate it. Well, hello, everyone, and I hope everyone's doing great today. I wanted to just, kind of give you a background about my journey becoming a dentist and owning. So we'll get started. So I had trauma in 7th grade. I fell from a cheerleading lift on a basketball court, and I was so lucky that I had braces because the braces acted like a splint. And what ended up happening is I ended up having braces that went into my gums, and I had to go to the ER, and then I went to a dentist the next day, and I was so fortunate that I was able to save my teeth. But because of that, I've had a lot of work done. I've had a lot of root canals and crowns, and you can't tell because I had a great mentor and dentist. So from that experience, I decided that I sat in the dental chair for so many hours that I thought, why not try becoming a dentist? So I started a dental assisting program my senior year of high school. I went half days at my high school, and then I would go to a career center. And then after that in college, I did over 100 hours. And then I graduated from undergrad with a psychology degree, which is a little unusual. Usually you do chemistry or biology, but I wasn't as interested in either of those majors. So I decided to be, a little bit different. And I also thought it would be a great idea to do psychology because a lot of patients have dental anxiety. And then I went on to IU School of Dentistry, where I graduated in 2018. And from there, I did corporate dentistry, and then I went into private practice, which the ultimate goal was to become an owner. Well, I thought I would become an owner 5 years after dental school, and surprise, I bought my practice. Actually, it was just a little over a year now. So I call it a boutique practice because I really wanted to be a little bit more concierge, especially with the pandemic. We had a lot of patients who were very, scared of COVID. And so what I would do is, I would either have them be the last patient of the day so that no one was there, or I would, make a specific time frame for those patients. You see a lot of corporate offices buying many private practices. And so I just really wanted to kind of be different. And I have always looked for a dental practice out of school. And I stumbled upon one because with the pandemic, it kind of pushed a lot of dentists into retirement. They decided that they didn't want to practice anymore, and they kind of got a taste of retirement with the shutdown. So I was very lucky with the practice that I bought, but it may take, a couple of years to find the right one because you want to find a practice that meets all of your requirements as a dentist. And that means the specific procedures that you do, as well as the location. It's really actually more location than procedures. So I got very lucky because it was the city that I wanted to live in. This is my handle, so you can definitely follow me. I try to keep up to date with books that I read for business, for ownership, or dentistry. And I always put on, some of my favorite products that I'm using at the time. So, all right. Some advice that I have for pre-dental students, definitely shadow, make sure this is the profession that you want. You want to love what you do because if you love what you do, it's not really work. Find a mentor. I definitely recommend. I can definitely say there are 3 great people out there that I can call during the day, at night, ask them, email them, text them. They are wonderful people, and I'm very thankful that I have 3 great people that I'm able to do that. And these all three people have different philosophies on dentistry. And so I definitely recommend, seeing different sides of dentistry, because there are ways to treat patients completely different, which is a great reason why this is a great profession. Definitely study, as everyone knows. I was taught by an oral surgeon at 17 when I was getting my wisdom teeth out. And I remember the consultation, he pulled me aside and he said, "You really want to be a dentist?" I was like, "Yes." He goes, "Here is my quote. ABCs, remember this. A's open doors, B's keep doors open, and C means you're closing that door into getting into dental school." But you can definitely come back from that. If you do get a C, remember, you can always retake a class. So don't feel like that is definitely C means close. It just means you got to try again. Never give up on your dream. You're going to have moments where you're going to fail. You're going to have moments that you're going to rethink, is this the career that I want? Never give up on it, because if you go into another career, you may, say to yourself, have that regret of not trying to get into dental school. If you put your mind to it, anything is possible. Trust me. I was never the student that in dental school, I was never in the top 10 of my class. I worked really, really hard just to graduate, but I did it. And we all have our talent, especially in dentistry. Some are more talented with taking exams, and some are more talented with clinical work. And then there are the well-gifted people of both. So definitely have a good work-life balance. In college and in dental school, you have to find a time for yourself, and you have to give yourself time to breathe from school. I definitely recommend, taking at least an hour a day. I know that sounds crazy to everyone who is studying for the DAT and, studying for organic chemistry. Oh boy, you take that organic chemistry test, and then the next hour you're taking a molecular bio test. So I remember those days, but you definitely have to, I play golf. I went and hit golf balls with my classmates in dental school afterwards. It was a great release from dental school. So definitely recommend that good work-life balance, because you have to have your mental health. I cannot stress this enough, that there are times where you're going to go through, and you have to take that time for yourself. All right. What is general dentistry? So as I said before, there's so many different philosophies with dentistry and how you treat patients, but general dentistry is really treating the patient's oral health as well as the overall health. You can find things with patients that they didn't even realize what's going on with their overall health in the mouth, which is so fascinating to me. You can see diabetes. That's a big one. You can even sometimes diagnose a patient with pre-hypertension or high blood pressure, which is very, very important for a patient to know, because they need to be seen by a general physician as well. Oral health specifically, that's what we see day to day. That's, treating cavities, pathology, pain, any type of teeth complaints, that's such as sensitivity, aesthetics. A lot of patients want that celebrity smile. Definitely teeth and jaw alignment. We see a lot of patients who forgot to wear the retainer, and so they want to get back into braces. And another huge one is cracked teeth. And that can be from just, constant grinding and clenching at night. So when you're in dental school or in college, make sure you wear a night guard, because you might go through a very stressful time that may cause you to clench or grind your teeth. So I still wear mine, and I own a dental practice. So anyway, so treating patients, I love seeing patients as early as 1 year old in my practice. It is so much fun to watch them grow, and you get to treat multiple generations in a family. Grandparents, kids, grandchildren. It is absolutely fun, because usually they don't realize that they schedule their appointments one right after the other. And so it's so much fun, to have a fun environment. and your patients become your family. They care more about you than you realize. My patients text the office and they wish me well on my vacation next week. So it's just a lot of fun. All right, a typical day in my office is 7:45. We do a morning huddle where all the employees come in and we kind of go over the day. We definitely touch base and on patients. I always want to stay in their lives as well. So I always keep in mind kind of where a patient is at in their career. So if they're about to graduate from college and I know that they are probably going to get an athletic scholarship, we just kind of go over that with the employees. So they can ask, how's college search is going, so that, they really know that we care a lot about them. 8 a.m., we do a start time with patients and it goes till 12. And then we do an hour lunch. And then we go from 1 to 5 and have some more patient time. And that patient time is, emergency exams, cleanings, fillings, crowns, or follow-up treatment. A day, like I said, can include all of those things, and diagnosing pathology, referring to specialists. And a lot of times I'm kind of on the phone at least once or twice, coordinating with a physician or a specialist, and then just getting to know my patients. And like I said, always having fun. So, all right, what kind of complaints do patients present with? Recently, we've been seeing, like I said, a lot of jaw hurting that is TMJ issues, especially with the pandemic. A lot of clenching and grinding, like I said, and which follows into cracked tooth syndrome. Misalignment of teeth, we kind of already discussed about that with patients wanting to get back into orthodontic work. Sensitivity teeth, you would be surprised at how many patients have very sensitive teeth. It is so important to kind of discuss with them, why they have sensitive teeth. There could be multiple reasons. Specifically, their outer shell of their teeth, that's the enamel, can be pretty thin. So it can expose dentin, which can cause sensitivity. Receding gums can also cause sensitivity. Or, they may just have sensitive teeth from whitening. So talking with them about, the protocol and things like that can really help them, toothpaste or cutting down that time on whitening. Shade of teeth. Lots of patients love, like I said, that celebrity white smile. I try to take pictures of patients' teeth, holding up a shade guide so that they kind of have an idea of where they're at with their shade of their teeth. And I also show them next to their shades of their teeth what normal shade looks like, because we kind of forget that normalcy of shade of teeth. All right, what kind of procedures do general dentists perform? Fillings, crowns, I said Invisalign, but it can be any aligners because there are a lot out there now. Simple extractions, some general dentists even do more expensive oral surgery. Endo, which are root canals, whitening, and veneers, which is a little bit more aesthetic than crowns. All right, diagnostic tests and instruments used. So there are lots of different instruments that other dentists can use. These are just ones that I specifically use in my office. An intraoral camera, it is so important to use that because sometimes patients, they weren't, taught to read x-rays. So an intraoral camera can be really your friend in showing a patient what they can see. Black light, which is interesting. I was taught this by my mentor. There's a specific, when you're doing a filling, there's an adhesive that we use that is clear. And the adhesive sometimes kind of gets on like parts of the teeth that you don't want to be there, because when they bite down, that adhesive goes away, but it's more comfortable for a patient to walk out having their normal bite. So that black light actually picks up that clear adhesive. Percussion testing, so that's just simply like tapping on a tooth. And if a patient specifically says, oh my gosh, that hurts, that usually means that there's something going on with the nerve and the nerve is flared up. New technology. So there are different products now that actually have ingredients in them that are helping with the regrowth layer of the teeth. Another thing is stopping cavities from spreading. I use silver diamine fluoride. It is specifically only used on certain parts of the teeth because it does turn the cavity black, and some patients don't want that seen in their mouth. That means that it is specifically just placed on the tooth and it's dried for 60 seconds. And it doesn't mean that we have to cut into the tooth. Sometimes you need to reapply that, months or weeks at a time, depending on if it actually stopped the growth of the cavity. Intraoral scanners. So anything such as CEREC, there are iTero now. It means it's literally taking an intraoral photo in the mouth and it is being sent to a lab or to your 3D printer to make the aligner. All right, important terms that I use on a daily basis for general dentistry. Resin, that's that tooth-colored filling. Caries detection, that's just another word for a cavity. There are 3 layers to the teeth. The outer shell is that enamel, softer is dentin, and then the nerve, which is the pulp. Occlusion is huge. Specifically with your TMJ, you're clenching and grinding, that means you're biting. So impacted teeth, definitely in your high school and college years, you may come across that, and then you'll just have them removed by a general dentist or an oral surgeon. All right, so to my favorite part, business, because we don't get to hear that very often when we're in college or dental school. So business decisions are huge. Sometimes I think I might have, they're more bigger than what I was thinking in dental school. It's like, wow, once you get out of dental school, it's going to be a breeze. Well, sometimes you're faced with a lot of decisions in business when you own a practice. But I think it's more fun because, you're going to make mistakes as a business owner and, you just learn from your mistakes. So let's go over this tape. So expenses are too high and you can't afford your bills. What are you going to do? So that means you're going in to submit payroll and you're like, wow, I don't have enough money in the bank account to cover our staff. You're thinking ahead of that payroll. So, I would say work smarter, not harder. And you always have to think about your return on investment. Buying that piece of equipment. Is that piece of equipment going to make my working time with the patient less so I could see more patients? Or is that equipment going to actually benefit my patients and giving better dental care? So some expenses are set in your practice and some can fluctuate. So you really have to find the expenses that that you're able to cut those costs, because you do not want to affect your dental work or affect patients, because you want to provide the best dental care every single day, every single minute you're with a patient, to that patient, because word of mouth is a huge thing. One person, if you do one, poor dental work on someone, they will definitely go tell everyone. So you definitely, and those Google reviews now are huge. So you just have to be really, really cautious. I always say a lot of my products in my practice are the Porsche of cars, because you really want to provide that good dental care. So in this situation, I found in the last couple of months that, we are using a texting service that I was, it's okay, but I wanted to be a little bit happier. My patients didn't like emailing their insurance card. They really wanted to take a photo and text it, because it is a lot easier. So I also found that my expenses were getting a little high because my internet, phone, and cable was all increasing. So in this choice, we have choice A. So we have the phone at $450, the internet at $50, so our total is $500. Choice B, we have the phone at $350, then the internet at 225. So it gives us a total of 575. Which one do you go with? Do you go with the one that's cheaper so that it helps save you money in the long run? Or do you go with the more expensive one because it's going to provide a little bit easier for your patients instead of having them email? So it's just a thought. There is no right answer here. So I will give you that I actually went with choice A because it actually was a better service and it saved me money too. So that was a benefit. So, all right, case number 2, 65-year-old female presents with half of their tongue is red. So you might be able to see this. It's kind of hard for me to see on my end, but it is the right top side of the mouth. It is a kind of like a triangle. We call it glossitis because it almost looks like there is no taste buds there. So there are a couple of different differential diagnoses for this. So anytime you see pathology, you always want to be thinking about what could be causing this, because you're going to actually have to explain to the patient that, what is going on and what to do next. Because, immediately they're going to think, oh my gosh, it's cancer. And sometimes it isn't. And in this situation, it could be a fungal infection or it could be a vitamin deficiency. So we kind of wanted to rule things out before going down the line of a blood panel. My patient was very concerned that they didn't want to get their blood drawn. So we decided that collectively as a team, that we would go with the nystatin. And that is an antifungal, and it did not go away. And so we asked the general physician to prescribe a blood panel, and it ended up being a vitamin D deficiency. And they are actually taking a lot of vitamin D that we didn't realize was going on. But then we also found out that there was another deficiency as well, another vitamin. I can't remember off the top of my head. So it was actually a great, it ended up benefiting the patient for their overall health. And by the way, I don't have an after photo, but the redness on the tongue is gone. So that's exciting for the patient especially. All right, case number 3. We have a 70-year-old female. The cavity is under an existing crown. We have to remove the crown to get to that cavity. And then we'll have to what's called prepping. So that means that it's just making it's almost like a top hat to hold that crown on top of. And while we were doing that, what ended up happening is their gums were so inflamed because the cavity actually ate part of the tooth. And so the gums grew into the cavity. And so it was in the way for us to take an impression to send to the lab. So because I'm, what's called a startup practice, that's what the banks gave me. I don't have a laser. So I was a little creative when I bought my practice, and I was able to get a certain burr, what's called a tissue trimmer. And that's actually placed on our high-speed drill without water. And it just takes just a little bit of gum away. If you're trying to remove a lot of gum, you really want to use a laser. All right, advice for our future dentists, which I love hearing future dentists because it just means our career is growing more people. So shadow all professions. If you're on the fence of whether becoming a PA, a medical doctor, or a dentist, or any other profession out there, I highly recommend shadowing, multiple people in the profession to really get a better idea of what you would like. Listen to podcasts because, sometimes when you're driving or commuting, or even when you have some downtime or eating food, podcasts are a great way to interact with the dental community. There are a lot out there, and there's one specifically for business too. That's where I actually learned a lot before buying my practice. It really helped to hear other people, their stories on buying practices, to kind of give me advice and what to look for when I bought my practice. Read business books. There are so many out there. Some of my favorite ones are The Pumpkin Plan. That's actually one of my favorite books. Everything is Marketing. You don't realize that when you walk into a room with a patient, even the scent of a room is marketing. Or at the end of the procedure, we place chapstick on our patients because you do have them open for a while and it really dries out the lips. And then you give the patient the chapstick and it actually has their logo on it. So it ended up working out great because, like I said, everything is marketing. ABCs, remember, A's open doors, B's keep doors open, C's close doors. And definitely keep up the great work. We always forget, when you get that A on organic chemistry test, and then an hour later you have to go take a molecular bio test. Make sure you celebrate that A in organic chemistry because it is so important to celebrate the small stuff. I celebrate in my practice, getting a new patient, and with the team, it's just fun, to celebrate the small wins. Always ask questions for dentists, mentors, anyone in the profession, even hygienists and assistants that have been in practice for such a long time. I learned a lot from a dental assistant at a private practice. Have a great group of friends and study pals. Have that group chat. I'm still in group chats with lots of my dental classmates outside of school because you come across things that you may not see, and it's always good to get a second eye for it. Like I said, pick the profession that will make you happy with, because you don't want to go, it won't feel like work going to work every day. And work isn't work when you love what you do. So, all right, thank you so much for joining me. I think here's my social media handle. Definitely, message me if you have any questions too after all of this.
Thank you so much, Dr. Joyce. We can move ahead to the Q&A session. So our first question is, how do you recommend going about finding in-person shadowing opportunities?
Yeah, so I actually had a recent student at my office that actually just called our office and asked if we were accepting, students. I think that, wherever you are in college, if it's not in your hometown, Googling a local dental office in the area and, looking at their website and seeing if what they do as a dentist really interests you, and then reaching out to them. We have the capability of texting our office. So we've even had a student text our office too. So reaching out to local dentists or even your local dental society can definitely help you. In Indiana, we have the Indiana Dental Association as well as smaller associations within that throughout the state. And so I know a lot of dentists who are highly involved with any of those organizations are usually teachers and usually want to teach students. So,
did you ever consider any specialties?
Yeah, actually, I almost applied to pediatric dentistry. I loved, I actually, in my corporate office, we saw mainly kids when I graduated dental school. And I really loved working with, kids. And I decided last minute that I didn't want to continue on with more schooling. So I decided to move forward with buying a practice instead. So now going as a general dentist, owning my own practice, I really enjoy doing Invisalign. And I think even looking back on it now, I maybe would have thought about ortho, but as a general dentist, you get to do everything. And so it's great because I get to do a little bit of everything that I love as if I was a specialist.
What would you say is the ratio between like children and adults that you get in your office as a general dentist?
So I actually we're moving more towards 50-50, which is really awesome. I really did a lot of marketing that said we accept all ages, especially kids. And we had actually a lot of pregnant patients, and they were asking questions of, you know, do you recommend going to a pediatric dentist, or are you willing to see our patients? So I think right now we're maybe 30-70, but it's moving more towards 50-50. And it's a lot of fun to kind of break up the day, talking with adults and then singing Frozen with kids.
So I know a lot of like our dental shadowers community is interested in like looking for job positions as like dental assistants. So what piece of advice could you give for like a future dental assistant?
So I was a dental assistant before becoming a dentist, and right now as a dentist, I know there are a lot of owners out there looking for a dental assistant. So there are a lot of Facebook pages, actually, surprisingly. We have a huge network for specifically assistants in Indiana, and then dental hygienists in Indiana. And you can just post on Facebook and say, hey, I am a college student. I want to become a dentist, but I want to be a dental assistant. Anyone looking for a dental assistant that's willing to train on the job. I was trained on the job, and I actually am in the middle of training my current dental assistant to become expanded. And it is amazing to see someone grow. And I also think it's a great opportunity as a dental, as a pre-dental student, because you really start to get your hand-eye coordination as well as your hand skills.
Talking about hand skills, I know like a lot of dental schools nowadays require like some sort of manual dexterity. So do you have like any tips on how we could work on that? I know some people like play piano and things like that.
Yeah, a couple of my friends play piano. A couple of them did violin. I actually knitted. This sounds crazy, but and then I also did ceramics too in dental or in undergrad. And you would be surprised. The interviewers actually asked for my hand knitted outfits if they could see them in the interview, and I ended up deciding I brought like a baby hat, and then so it wasn't a lot of luggage, especially when you're traveling across the country. So knitting was great. I learned at a local knit shop, and now if only I had more time and I wasn't working so much with my hands, it is such a great stress reliever. And all of my classmates, when they started having babies, they all got that as a gift.
Speaking about the business side of dentistry, do you think that dental schools focus a lot on teaching their students?
Sorry, I have a cat. He decided to join us. Sorry. I'm
So
sorry,
cute.
what did you say? We had a visitor.
That's fine. Speaking about the business aspect, I was just wondering if dental schools are good about like teaching kids, like giving them like a foot in the door about the business, or do they just like throw you in the pool?
I think that every dental school is different, and so I can't really comment on each dental school. And when I was graduating from IU, they were really starting to change their curriculum to add more business into it. I decided my 4th year of dental school to actually do an online business program at one of the other local colleges, because I had a little bit more free time. I only took like, I can't remember, I think like 3 or 4 classes. It helped, but I wouldn't say that, you know, I didn't have to do that. But definitely finding your resources kind of on your own may even help you even more.
That's true. What was your favorite part about dental school?
My friends.
Yeah,
They
a
are
good support system.
lifelong. Yes, it is. And they are lifelong family members. I mean, I was carrying my classmate's 2-year-old around the whole dental school, and now he is a lot older. And so you get to, you become family, and you bond in a totally different way because no one understands the experience that you went through besides your classmates. And then definitely my teachers probably be a close second. So I still stay in touch with a lot of the teachers that I worked with a lot. They are also a great support system after dental school. I've connected with a lot of them because they have reached out to me because they found out that I did buy a practice, and we're actually working with the dental school to do a mentoring program. I didn't have parents that are dentists, but I do know that a percentage of classes have a huge percentage that do have parents. And so I didn't have that texting another dentist asking them, will I ever do a gold crown ever again? I didn't have that. So I think this is a great opportunity that we're creating with the dental school.
That's great. What year of dental school did you start to see patients like right there and not like mannequins?
Yeah. So I started seeing patients on a day-to-day basis in third year, but in second year, they allowed us to go up after we completed certain courses. I did do a filling my second year. So I know that there were a couple of clinical experiences that I was able to do even in second year.
Is there a residency for the general practice? And if so, did you do one and would you recommend one?
Yeah, so there are lots of different types of GPRs out there. I did not do one, and the only reason why I did not do a GPR is because I got a great job out of dental school. I had a practice that was multi-doc, and I was able to kind of bounce things off of them and ask them, questions. And so I felt very comfortable being on my own. I also felt like I had a great dental school experience hands-on clinically. So I felt very comfortable walking out of dental school, working on patients. So it's completely up to the person whether or not you do a GPR. I think it's all going to be based on whether or not you feel comfortable working on someone without a faculty member above you.
Okay, because in the GPR, you don't have like a faculty member with you. It's like totally like
No,
I don't know
you
how
do.
residencies work too much.
Yeah, you'll have a faculty member there, and then usually there's like a chief resident that also oversees you. So you also don't unfortunately get paid very well. Sometimes you actually have to pay to be a resident. And I really wanted to start working and making money because I was already in debt with dental school debt. So that's another reason. There are opportunities out there that you can even utilize. It's almost like a GPR, but it's really work. Like I said, with a multi-doc practice, you have that availability to go and ask someone what they think about this x-ray just to get a second eye.
How was your transition from undergrad to dental school?
I did not have a gap year. I was very fortunate. I was able to get in my first time. That does not mean that's actually usually more unlikely. So know that you may have to do try a couple times to get into dental school. A majority of my class, I would say a huge percentage was second or third time. I think we even had a fourth time applicant. So never give up on your dreams. I applied to 7 and got into 2. I did have a high GPA, but I did have a lower DAT score. And so I was very concerned that with that lower DAT score, I wasn't going to get in. But I spoke with some of my interview people once I got into dental school, and they said that they saw something that I didn't, that I portrayed, that I didn't see in myself. And I don't know what that special sauce is. So I wish I could, give you advice on that, but I'm not sure. So
I think everyone there had their pen and notepad ready to go.
Yeah, I know.
The secret.
I think that I speak with some people who know a little bit more detail about the application process, but I think what they're looking for is that you come across yourself in your personal statement. And I really explained a lot of, things that I failed on as a person and how it made me a better person, and why that, I think I got a bad grade in the class. And so I explained, what happened. And then I think explained, the reasons why I wanted to become a dentist. And I think that really it really came through with my personal statement. And I had 13 revisions on my personal statement. I still don't think it was ready to be submitted, but there comes a point where you just gotta put it down and just click the submit button. And I be an early applicant. 100% made a huge difference for myself. I applied on the first day, and I got the first interview day for a couple of the schools, and I know that made a huge, huge difference, specifically for my application. So
I know some dental schools do group interviews. Did you have any experience with group interviews, or were they all individual?
I did have a group interview, and it is very fascinating. You are surrounded by a lot of type A personalities. And I was lucky that I was in an interview that they actually kind of had you go around the table. So you didn't feel like you had to talk above the person next to you. And I don't think I really did probably a good job in that interview, because I am really not good about talking, trying to boast about myself or, compliment myself. That is something I cannot do till this day. So I think a group interview, practicing, I can't even remember the book that I had. It was like a dental interview book. I don't even know where I got it, but I remember sitting with some predental students, and we would go through the questions in that book, and it was almost kind of use it as if it was a group interview. So don't get discouraged about group interviews. It is completely, it's okay, and you just have more people in the room. And the interviewers they're really good at moderating. So I think my favorite was, I can't even remember the name of it, but I'm sure you guys can tell me the name. But they give you a case, and then you have to critically think during that. That was my favorite interview.
Yeah, so it's it's either an MMI maybe, or just a case-based interview question. But
yeah, and it was speed dating, so you had to go from room to room. I thought it made the day go by super fast.
Oh, that's so that's cool. I haven't heard of that type. Usually I think LeCom does group interviews, and they also make you carve a soap right in front of them. to
Oh,
test like
really?
your hand skills. Yeah, it's pretty cool. So we have one more question in the chat. For dental school, is it okay to apply in August of the dental application cycle after you are done with summer classes, or should you apply while you are in summer school of junior year? So
I think,
like,
yeah, that's, I think it'll depend on, you know, if you want to change your GPA, if that's like super important, or if these classes are specifically to get you into dental school. I think I had like, I remember I had biochem, and then I think I had like one more class that I needed to take my senior year and then go to dental school. And so that was not on my application. I think I put on there that I was taking it in like the fall or something. So it'll all depend on, you know, each situation. But I still think maybe applying earlier, because at this point your GPA is kind of set. You're really not going to move it that much. It might be just a little bit. So like I said, it's kind of case to case. I would ask your student advisor if you have a really good predental student advisor.
how do you notice weaknesses in a practice and address them?
That's a good question. So there are lots of different ways to notice weaknesses. It's better to have an outsider's perspective. I have a lot of really great friends that are also owners, and, you know, I'll tell them, you know, kind of what's happening in my practice, and they said, oh, is this and this going on? You know, so always talking with other owners is a good thing. But, you know, I came from multiple practices before owning. Even as a dental assistant, you really learn, especially if you sit up front. I sat up front for a rotation, and it was an eye-opening experience, because you kind of see the backbone of the practice, and you'll start to see some situations in a practice that are kind of going on, and you kind of have to go back to that backbone, and that backbone really is your front desk. You know, it is a team thing. So, you know, you have to really see everything that's going on. So for instance, I'll kind of give you an example of, you know, a weakness. So recently, I would say maybe like a month or two ago, we started noticing patients that didn't confirm appointments, and which I thought was weird, because before we would have a lot of patients who confirm immediately. They would text the word "see" and it was confirmed. And usually when someone confirms, that means they're going to come to the appointment. And then all of a sudden I started noticing unconfirmed appointments and then no call, no shows. And I thought that was kind of strange. It's not really usual for our practice, just because, you know, we communicate a lot with our patients. So we implemented this new system that if you're unconfirmed, we give you a phone call the night before, and we, you know, leave a message and we say, hey, you're not confirmed for tomorrow. If you don't give us a call back or text us by this amount, this time frame, then we're going to automatically you know, fill your appointment, and we'll have to reschedule for another date. I think because the world was opening up a lot more that time, patients just they were traveling and they were doing things that it just slipped their mind. So that was kind of a weakness that I saw recently. You can, if you work in other practices or even in dental school, you'll kind of pick up very easily on things for practices that even you will do better as a dentist.
Those were all great advice, Dr. Joyce. Those are all the questions that we have in the chat. If John, you have anything else, or?
Yeah, I can jump in with maybe one last question. I think a common maybe misconception is that majoring in, biology or chemistry or something related to STEM is like a major prerequisite for pursuing a career in healthcare. Would you maybe like to touch on the value of being, a non-traditional student or a non-traditional applicant rather?
Yeah, and I definitely would, if you have the availability to kind of be non-traditional, I definitely would recommend that. Not only will you stand out, because if I remember that they were interviewing me and they're asking me, why did you choose psychology? That was a hot topic. So, my last year in undergrad, I actually did a research paper about dental anxiety. And I will definitely tell you that having a psychology background, especially working with kids, definitely helps, because even learning the different types of learning disabilities, or anyone who has any type of challenge in their life, as a psychology major, I have picked up on patients that might have some form of a learning disability that I'm not sure if their teacher picked up on it, because they don't put it in the medical history. And so I definitely would challenge you to do something different that you love to do, because if you go through undergrad and you absolutely hate biology and you're a biology major, it's not going to be fun. You're not going to get the grades that you wanted to get into dental school. And really, you're just kind of, doing something that may not help you in the future. So for instance, if I didn't get a dental school, I didn't really have a backup, and I don't recommend that. So you definitely pick a major that, may help you, at least for that gap year. My truly only backup was I was going to become a Disney character. So I had the audition all filled out, ready to go up to Chicago. And the next day I found out I got into dental school. So I'm really, really glad that I got into dental school, but maybe I would have had a good time being a Disney character. So, but like I said, definitely choose a career that will help you, be the best version of yourself. And having that psychology major is definitely helping me as a dentist, because patients will really open up to you, and they may not open up to other people because you are so close in proximity to them when you're working on them, that afterwards they are very comfortable being around you, and they just kind of they really open up. And so I really like that I had my psychology background as a dentist.
That's awesome. Thank you for sharing that wonderful piece of insight. And I think that's a perfect closing remark. So we'll go ahead and conclude today's session on that note. Dr. Joyce, thank you so much again for taking the time to join our session today. We wish you a productive year.
Thank you. Thanks everyone for joining.